I have a lot of expectation, mainly as every year, because every year there's something sensational in Sepa. Just a lot of people, a lot of clinicians, and a lot of information. They are always very intensive day. And Sepa, I think, right now is one of the most important society that we have in the world around perio and implant dentistry. So my expectation is very high, as usual, I would say. I'm going to treat the posterior mandible. It's a vertical bone augmentation. The defect is quite huge because will be around 3 centimeters mesiodistally and around 8-9 millimeters in the vertical direction. What I'm going to show you is a vertical autogenous bone augmentation following the Curie technique, but everything will be fully guided, meaning that we are going to have the computer-guided bone harvesting, we are going to have the computer-assisted block management, and we are going to have the computer-guided bone fixation. So the participant will appreciate how digital dentistry can penetrate into a surgical procedure that typically is known as a freehand approach. And at the same time, people can learn how to manage the soft tissue, which is a critical point of the surgery. Live surgery, it's every time, I think, something strongly related to emotions. In such a way, the participant can leave a little bit the stress and the emotions of the surgery because it's happening real time. The live surgery has a multiple information because we are going to see how to manage the flap design, flap elongation, flap passivation, wound closure, not just the bone vertical augmentation. There will be a lot of information that will run in 1 hour, 30 minutes. And I think that will be a great opportunity to expand our vision around vertical bone augmentation in the posterior mandible. So even for those that are not used on doing vertical bone augmentation, it's a great look on what is going to happen now, at least in the surgical field, to treat this type of deficiency with the maximum technology that we have nowadays for perform everything in a guided, predictable and replicable way.